Hello, everybody. Thank you for joining me today. My name is Candace. I am one of the dementia care specialists for Milwaukee County Department on Aging, and I'm going to talk to you a little bit about some Dementia 101 today. This presentation is, a basic overview of dementia and the diseases. Topics I will cover during this presentation include dementia rates in Wisconsin, thinking processes impaired by dementia, the definition of dementia and the different diseases that cause it, how dementia changes the brain, and some basic community resources. Okay, so I always like to start with a basic overview of Milwaukee County Department services, just in case any of you haven't heard of Milwaukee County Department on Aging or aren't sure exactly what we do. So we actually divide our services into two main categories, so meeting vital life needs and meeting quality life needs. So meeting vital life needs, that's things like food and shelter. So we have, the Meals on Wheels program. We have the long-term care program, which provides help and assistance in the home for those who qualify. We also house the elder abuse unit for Milwaukee County, as well as 2 dementia care specialists, including myself. We also have meeting quality life needs. So we have a variety of wellness programs. We did have those in person, but now due to the pandemic, we are offering some of those wellness programs virtually online. We also have senior centers as well as the senior dining program. Since the pandemic, that has converted over to more of a curbside pickup layout instead of the communal sitting down eating all together in one big room. And we also offer transportation as well to the grocery store for free, and then also to any medical or dental appointments for a fee of $3 each way. I also like to just touch on our mission. Our mission guides all of the services and things that we provide to seniors in the county, which we consider senior 60 and older. So the mission of Milwaukee County Department on Aging is to affirm the dignity and the value of older adults of this county by supporting their choices for living in and given to our community. Okay, so what is a dementia care specialist? Some people haven't really heard of, what we do, so I just like to talk a little bit about our role so people might have a better idea of the services and help that we can provide. So all dementia care specialists are housed in aging and disability resource centers. You can see the map on the right-hand side. All of the counties that are in purple currently are served by a dementia care specialist, as well as the little boxes in green, which are tribes around Wisconsin that have their own dementia care specialist. The counties in white currently aren't served by a dementia care specialist, but hopefully one day we will have those counties covered. When did this start? What do dementia care specialists do? So we serve about, I think, 33 counties throughout the state. The program started in 2014 as part of the Wisconsin Care Redesign Program. Let's see, and then our goals or our main duties to what we do for our job as dementia care specialists is, 1, to support the Aging and Disability Resource Center staff and other county programs to be better prepared with knowledge and resources to support individuals who are living in the community with dementia and their families or caregivers, to assist as a catalyst to create more dementia-friendly communities, help businesses, employers, local organizations, and the community to help raise awareness of the unique needs of individuals with dementia and their families. And then lastly, most importantly, to assist individuals with dementia to remain active and in their homes and provide support to their caregivers. Okay, next I always like to clearly define what is dementia. So some people aren't really sure what it is, or sometimes they mix it up. They're like, oh, Alzheimer's and dementia, they're the same thing, but they're actually different. So I always like to clearly define it so we're all on the same page. So Think of dementia as this kind of umbrella term. Dementia really describes a group of symptoms that are associated with a decline in memory and other thinking skills. So it's not really a disease within itself. It's the diseases under this, dementia umbrella that actually cause dementia symptoms. So like Alzheimer's, vascular, Lewy body, frontal, temporal are the diseases that cause dementia. There's actually, I think, about 50 or 60 different types of diseases that cause dementia. And for a person to be, considered to quote unquote have dementia, they have to have 2 or more core cognitive functions must be impaired. It's a change from their baseline, and that's very important. It's a change from their normal day-to-day baseline. And it affects their, day-to-day life. It affects their abilities to, carry out tasks, take care of themselves, that type of thing. And it's also not explained by something else. So it's not explained by depression, medication, delirium, or a thyroid problem. Okay, and now I just want to spend a couple minutes talking about what dementia rates look what they look like right now in our state of Wisconsin. So right now we have about 120,000 people who have some form, of a dementia diagnosis. That's enough people to fill Lambeau Field and Miller Park at the same time. So that is a whole lot of people, and the number is only going up. So by year 2025, that's only 5 years from now, that number jumps to 130,000 people. So we're only increasing the number of, folks we have living in our state who are getting diagnosed with dementia. At the age of 65, 1 out of 9 people will have some form of a dementia. And at age 85, that number increases to 1 out of 2. So half of everyone living who's over the age of 85 will have some form of dementia. Okay, and I want to talk a little bit about how dementia is actually diagnosed. So, there is no single test that will show that somebody absolutely 100% has Alzheimer's disease, but experts estimate that skilled physicians can diagnose Alzheimer's with more than 90% accuracy, so they can get pretty darn close. And when a physician is, evaluating or seeing if someone does have a type of dementia, they're really doing a deep dive. So they're going, doing a very thorough, detailed review of their medical history. They're doing mental status testing. They might do a physical and other neurological exams. They'll also do blood tests, brain imaging to any physical reason that might be causing the person's dementia-like symptoms. So if you're taking a loved one, to the doctor to have them evaluate, they really should be doing all of these things, not just a quick little test and saying, oh, boom, they have dementia. They should really be doing these things. Okay, and then what is the importance of early diagnosis? So this, it's kind of that old saying, the sooner you know about something, the better. It's a better chance to benefit from treatment. Treatments for dementia is only really effective in early stages, so it's better to start it sooner rather than later. There's more time to plan for the future, lessens anxiety about unknown problems or what's to come. It also gives you a chance to participate in research. That's something that a lot of folks that I work with have told me. They're like, well, if this is going to happen to me, then I want to be able to give back. I want to be able to help people in the future to maybe find a cure or help with treatment. So it's participating in research early on is really important to them. It also provides them an opportunity to participate while they still can in decisions about their care. So financial, legal matters, living options, what they're comfortable with, what they don't want. Also transportation options when they're not able to drive anymore. It also allows for them to really develop good relationships with doctors and care partners that can fit their needs. Maybe a general, practitioner for a doctor or PCP isn't, maybe the best fit for someone who has dementia. Maybe finding a geriatric doctor might be a better fit for that particular person. So just giving yourself time to kind of, find those new relationships and care partners. Lastly, it also provides you an opportunity to find, supportive services, making it easier for you and the family around you to kind of manage the disease, being able to bring in support when you need it later because you kind of know generally what's out there, so you can tap into that support when you need it. Okay. I just want to talk a little bit about normal versus not normal aging, I had kind of touched on it a little bit before when I said, like you're diagnosed with dementia if it's a change from your baseline. That is a big thing that I want you guys to kind of know about and look out for. So it's starting to be, changes than what is normal for you. So you might be, you can't think the same. You can't do things like you could before. Like for example, if you, every month you like balance your checkbook, and if you came across an issue with it, you were able to fix it really quick, no problem. But now you might be coming across issues balancing your checkbook and you just can't figure out what the issue is. You can't fix it, so you're getting stuck. So you can't do things like you did before. Maybe you're having issues with initiating activities or tasks, getting started. Maybe you don't feel like you can think things out like you did before. Maybe sometimes if you are talking to someone over the phone, you really can't place who the person is. Words won't come to you at all. I know we have all, those issues with finding the right word or word finding, but if the words don't even come to you even later, that might be a red flag. Or if you start to get confused about past and present time, you start to get those kind of mixed up, those can be some signs of not normal aging. Okay, but it's not, it's not always, if you're having some of those things going on, some of those signs of not normal aging, it's not always dementia. That's why I always encourage people to go talk to their doctor, see their doctor, because it could be a reversible type of dementia, treatable, like a physical reason, something that's causing your dementia symptoms. But if you cure that underlying symptom, those dementia-like symptoms will go away. I'm going to talk about these, in detail in a few slides, but just to kind of brush over them, quickly, there's, medications can cause dementia symptoms, depression, other medical problems, hearing and vision impairments, vitamin B12 deficiency, infections like a urinary tract infection, and of course, delirium. Okay, I do want to focus on depression because, depression rates are going up as of recently, and it is the most common cause of quote-unquote reversible dementia in older adults. So unlike, younger individuals, older adults who might be experiencing depression can present with actually cognitive impairment, confusion, memory disturbances, attention deficits, which can be mistaken for dementia. So instead of typically seeing, the depressed mood, the flat affect, those type of symptoms that we typically see in depression in younger adults, older adults will actually seem like they're getting more confused and have memory issues. All right, and then this is another very, very frequent cause of reversible dementia is medication issues. So it can be because your doctor prescribed a new type of medication, it's interacting with something maybe you're already taking, and it's causing you to be confused. Some side effects of medications can also be issues with memory, slow cognition. It can actually affect your memory and your cognition. So it's good to really talk to your doctor about your medications and also really let them know if you're experiencing fogginess, memory issues, you can't remember, you can't think the same. I would really encourage you to talk to your doctor about it because it could be due to, a medication side effect or an interaction with something else that you had already previously been taking. And dementia symptoms can also be caused by some of these systematic disorders, so like metabolic, endocrine, nutrient system disorders, like vitamin B12 deficiencies, are additional causes of reversible dementias that can be pretty much diagnosed without, with some routine laboratory tests, so some blood work. UTIs, dehydration, and malnutrition are very, very common types of reversible dementias in older adults, and these types of things really do need to be ruled out first before a physician does officially diagnose somebody with dementia. Okay, and then these are some of the different types of dementias that I'm going to be going into in a little bit more detail. Okay, Before I go into Alzheimer's disease as my first dementia that I'm going to talk about, I really want to talk about some of the thinking processes that are impaired by dementia. So we typically see this across the board in multiple types of dementia. So dementia just doesn't affect your memory, it affects other things, like it affects your judgment, so your ability to problem solve, to consider outcomes, consequences, weighing the risks. It also affects your ability to pay attention, to stay on task, to concentrate. It also affects your perception, so your ability to interpret things around you like sight, smell, touch, and sounds, your reasoning. It can, affect your ability to bargain, negotiate, or even perceive levels of danger and risk in your life. It also affects your ability to organize, to plan, to initiate, to follow through with activities. Of course, it affects your memory, especially the short-term memory in the beginning. It also affects your ability to communicate, to give and receive verbal and nonverbal language. So people will start to have trouble getting their point across or telling someone something it's not making sense to the other person, or a family member might be telling them something and they just don't understand what the other person is asking of them. And also to think abstractly, the ability to perceive concepts, hold multiple thoughts simultaneously. So dementia really affects all of these different things, not just memory. Okay, so the first type of dementia I do want to talk about is Alzheimer's disease. It is one of the most common types of dementia. It accounts for up to 60 to 80% of all cases. This type of dementia is actually caused by plaques and tangles that damage our brain cells and our nerves. It usually develops slowly and gets worse over time, so it's typically, the person themselves might even recognize the early signs or family around them. It's just a few things here and there, like, losing a few things around the house, forgetting a few words, forgetting a few appointments. But then eventually over time, as the plaques and tangles start to damage more and more parts of your brain, the person or the family might start to see more and more deficits becoming severe enough that it's actually interfering with the person's ability to complete daily tasks or take care of themselves. Like I said before, an early symptom is typically issues with short-term memory, but some later symptoms of Alzheimer's disease is impaired communication, poor judgment, disorientation, confusion, behavior changes, and difficulty speaking, swallowing, and even walking. So near the final stage or the last stage of Alzheimer's disease, typically the person is completely dependent on caregivers or a caregiver for all of their daily cares. Okay, and then I always like to show the brain in relationship to Alzheimer's disease because it really gives a good visual of what this disease does, and it's hard for family members to see because you can't look at somebody and be like, oh, 100% they have Alzheimer's disease, because you can't look in their brain and see what's going on in there. So this is an image of two people who had passed away at exactly the same time, same age, same gender. Everything about these two people were exactly the same, except the person on the right passed away from advanced Alzheimer's, whereas the other person died with a perfectly healthy brain. They didn't have any type of dementia. So on the left-hand side, you can kind of see how the brain is very full. It kind of looks like a cauliflower that's cut in half. And then on the right-hand side, you see how Alzheimer's disease has shrunken the brain. There are these big gaps, these big holes, these big crevices. The area where short-term memory is typically stored is almost completely eroded, away. So this is what Alzheimer's disease does. It literally erodes the brain away. And this I always like to show to family members that I work with, because it really gives them a good idea, if your loved one is doing a specific behavior and you're not sure why, or if you get really frustrated because you told them 5 minutes ago to do something or answered their question and they ask you again, or they don't remember, what it is that you asked them. Don't get frustrated, don't get upset, don't get mad. It's nothing that they're doing on purpose. You're just asking them to do something that their brain physically isn't capable of doing anymore. So this can be really powerful for caregivers to see. This is a video that I like to usually show during this presentation, but I'm not able to kind of switch over to it. But take this time, write down the web address, or go to Google and find this video, or not not Google, YouTube and find this video. It's a really nice short animated video of how Alzheimer's plaques and tangles work their way throughout the brain and how they affect it. So it's a really nice short little video. So I encourage you guys to look it up and go watch it. Okay. Next, I want to talk about vascular dementia. So this is a type of dementia that is caused by conditions that block or reduce blood flow to the brain, depriving brain cells of vital oxygen and nutrients. And then, depending on the number, the size, the location of the brain injury, that will kind of determine the individual's deficits in either thinking or physical functioning. So where it happens in the brain, that's where you'll see the effect, or you'll see the deficits. And it's caused by these little brain injuries such as microscopic bleeding or, blood vessel blockages. Vascular dementia actually used to be called post-stroke dementia in the past. It accounts for about 10% of all cases. Symptoms usually include impaired judgment or ability to make decisions. Plan or organize is more likely to be an initial symptom, as opposed to the memory loss that is often associated with, like with Alzheimer's disease. Okay, next I want to talk about Lewy body dementia. So this type of dementia is caused by abnormal microscopic deposits that damage the brain over time, called Lewy bodies. So most experts estimate that Lewy body dementia is the third most common, accounting for 10 to 25% of all cases. So symptoms of Lewy body usually include, they often have memory loss and thinking problems as commonly seen in Alzheimer's, but are more likely than people who have Alzheimer's disease to have initial or early symptoms such as sleep disturbances, very well-formed visual hallucinations, and muscle rigidity that is kind of similar to something you might see in Parkinson's disease. And the visual hallucinations is a big one. They typically will have hallucinations about people, children, or animals or bugs. Like they might see people who aren't there, they might see bugs on the walls, animals in their room that aren't there. So those are just kind of a few examples. Okay, next I want to talk about mixed dementia. So this basically means that someone has more than one type of dementia. This was, once considered to be more rare, but in recent years, doctors are finding this is way more common than they had thought. More and more people are actually having multiple dementias going on at the same time. So somebody might be diagnosed with Alzheimer's and vascular dementia. And then depending on which two dementias that they have been diagnosed with, those are the symptoms that you'll see in the person. Okay, next I want to talk about Parkinson's disease dementia. So someone gets diagnosed with this type of dementia if they are first initially diagnosed with Parkinson's disease and then they don't develop dementia-like symptoms until a year or more later. So they have to be diagnosed with Parkinson's first. The average time from onset of Parkinson's to developing dementia is about 10 years, and developing dementia in patients who have Parkinson's disease is extremely common. They estimate from 50 to 80% will actually develop dementia in their disease, process. And then some of the symptoms that you see are very, very similar to those of Lewy body, and this is kind of a reason that some people might actually get the wrong diagnosis because the symptoms are so similar, but they should initially be diagnosed with Parkinson's first, and usually the early signs of Parkinson's disease are typically movement issues or movement deformities. Okay. Next, I want to talk about the frontal temporal dementias. So these type of dementias are actually dementias that like to target the frontal and the temporal parts of our brain. So the frontal lobe of our brain is actually located right behind our forehead, and then the temporal lobes are located right behind our ears. These types of dementias include behavioral variant, primary progressive aphasia, Pick's disease, and progressive subnuclear palsy. FTD dementias were once considered rare, but now they're considered to be more and more common, up to 15% of all cases. And frontal temporal dementias usually develop earlier in life. So people start to develop them in their early 50s, early 60s. And some of the symptoms, so you won't actually see issues maybe with short-term memory, but some of the symptoms will actually be a lack of empathy, impulse control issues, impulse behaviors, problems understanding language, issues with balance, walking, and swallowing. So this can kind of be a tricky one for physicians to diagnose, because again, like I said, you don't see that typical memory loss, but you see a big change in personality, and the person just isn't acting the same because, of course, our personality is housed in our frontal lobe, and that's where these types of dementias like to target first. Okay. The next one I'm going to talk about is Creutzfeldt-Jacobs disease. So this is a very, very rare fatal brain disorder affecting, people like 1 in a million yearly worldwide. So it's extremely rare, but it does happen. And it's a type of dementia that progresses unusually fast, so very, very quickly. There are a few different types of this dementia. So the first one is sporadic CJD. So this one develops spontaneously for absolutely no known reason. And it's the most common one, 85% of this particular type of dementia. The next one is familiar CGD, and it's hereditary, so it's caused by certain changes in the prion protein gene. These genetic changes are dominant, meaning that anyone who inherits this specific gene from an affected parent will also develop this disorder. And then lastly, there's infectious CJD. This one is especially rare, and it is actually caused by exposure to an external source of abnormal prion protein. Okay, next I want to talk about Huntington's disease. So Huntington's disease is a progressive brain disorder caused by a single defect gene on the chromosome 4. The defect is dominant, meaning that anyone who inherits it from a parent will eventually develop the same disease. Symptoms of Huntington's disease usually develop between the ages of 30 and 50, but can appear as early as 2 or as late as 80. Experts strongly encourage professional genetic counseling, both before and after genetic testing for Huntington's disease. Symptoms of Huntington's disease typically include abnormal involuntary movements, a severe decline in thinking and reasoning skills, irritability, depression, and other mood changes. Okay, next I want to talk about MorningKorsakov syndrome. So this is a type of dementia that is typically most commonly caused by alcohol misuse. So somebody who has had very heavy alcohol abuse for a big portion of their life. If they develop dementia later in life, it probably is due to this one. It also can be associated with AIDS, chronic infections, poor nutrition, and certain other conditions. Some of these symptoms with this type of dementia are memory problems, while other thinking skills like social skills might be relatively unaffected. Okay, and I do just want to talk about some of the medications that are typically used right now to help treat memory issues or treat for, quote unquote, treat for dementia. So there are no known cures to stop dementia or Alzheimer's disease from progressing, from happening. So there is really no known cure, but what these types of medications actually do is they actually add extra neurotransmitters to our brains to kind of help our brains function and talk to itself and communicate with itself to get messages through for a short amount of time. These medications are typically effective for about 2 years and are only really effective in the early stages of the type of dementia. So some of these medications include Aricept, Namenda, Razidine, and Exelon. The last one there is no longer available in the United States. Okay, so let's say you have a parent or you yourself are diagnosed with a type of dementia. What do you do then? So you've been given this diagnosis and the doctor says, I'll see you in 6 months or a year from now. and then that's it. What do I even do now? So I always recommend like knowledge. Knowledge is power. So start learning about the disease. Start learning about the disease process, the progression, symptoms, behaviors that you typically see, in this type of dementia. And also attend maybe like caregiver classes if you're a daughter and your mom was just diagnosed with it. And also learn about, resources that you can tap into if you need help caring for her one day, because you probably will. The next one is plan for the future. So, what supports are gonna be around? Can you rely on family, or are you gonna have to hire professional caregivers? Also, home safety. Is it safe for mom to live in her home right now? And will it be safe for her to live in her home by herself 2 years from now? So really thinking ahead. Also, like I said, get connected to local support. So get connected to your local Aging and Disability Resource Center in your county, with your local chapter of the Alzheimer's Association. Maybe talk to a senior advisor to learn more about different living situations or facilities that you have in your area, and other community supports. Also, it is so important to get your financial and your legal stuff in order while, the person can still participate in those decisions. They're still, competent, they're still capable. So get those powers of attorney for healthcare completed, powers of attorney for finances, living wills. Maybe talk to an elder law attorney to make sure everything for mom or everything for dad is sorted out and taken care of, so you don't have to worry about that or come across any issues in the future. Next, you want to, of course, learn about like those care options. So the long-term care program offered through your county, would your mom or dad or a loved one qualify for that, to get some in-home, support? Of course, learning about in-home care agencies in your area, assisted livings, CBRFs, nursing homes, and of course, memory care units. Okay. And then lastly, I just want to go over, some of the community resources that we have, in the Milwaukee County area. So here's the Milwaukee County Department on Aging. That is our address, our hours, our call center phone number, our website. We still do have a few adult day centers that are currently open for caregivers to get some respite and have their loved one, looked after. We have senior centers that are doing a lot of virtual or phone programming right now. Of course, we have our local chapter of the Alzheimer's Association. That is a great resource for education and, of course, for support. We also have the Wisconsin Alzheimer's Institute, which manage our network of memory diagnostic clinics. We have multiple clinic locations statewide, and then we also have 6 locations here in the Milwaukee County area. Of course, we have memory cafes, and for those of you who know what a memory cafe is, we were having those in person, but now a lot of the memory cafes are meeting virtually. And to find out more, please contact the Alzheimer's Association or visit their website. They have a nice list of all the virtual memory cafes that are going on right now. And of course, we have our local, like dementia-friendly communities. Okay, thank you very much for, listening to my Dementia 101 presentation. Thank you for spending the afternoon with me. I hope you have learned, something new. And if you ever want to reach out to me, you can always call the Milwaukee County Department on Aging phone number, and you can ask to be connected to a dementia care specialist. If anyone has any questions, please type it in the comments below, and I'll be happy to answer any of your questions. Thank you again, and have a great rest of your day, everybody.